Herzlich willkommen zu unserer
So, ladies and gentlemen, I wish you a very warm welcome here today on our to our. I wish you a very warm welcome. It's lovely to have you here. I'm Sylvia Urban. I'm a board member of the German AIDS Hilfe, and we one of the organizers of this conference. So just let's say 10 minutes ago, we heard a huge noise. Our colleague Susanne Müller from Bread for the World had to leave her office because there was a fire alarm. So now I would like to read the Susanne's speech on behalf of Susanne, of course. So first of all, on behalf of Action Against AIDS Germany, AIDS Action Europe, German AIDS Aid, and Bread for the World, I would like to wish you a very warm welcome here today to this Eastern European Conference on HIV. My name is Sylvia Urban, but Susanne Müller was intended to do the speech, and she is a consultant, or she works as consultant for Europe at Bread for the World. So first of all, I would like to tell you that the conference will be held in 3 languages: German, English, and Russian. So like our technical support just said, you find this little icon looking like a globe below in the menu, in the Zoom menu, and you will have the opportunity to benefit, to enjoy a translation into English, German, or Russian. So you can click on it and enjoy the translation. So we are very pleased, we're very happy that the conference gets so much attention. I think by yesterday, around about 180 people interested had registered, and today we can welcome people from 33 countries from the regions of Northern, Southern, Western, and Eastern Europe, Central Eastern Europe, South Eastern Europe, from the Caucasus, Central Asia, and the Middle East. And this is definitely a great benefit due to this online format of our conference. So I think most of you know that our conference was intended or was scheduled to take place in March this year, but a week before the conference should have started, COVID-19 descended upon us all. So what we would like to do is to talk about HIV as human rights work, and what we wanted to do is to discuss this in a protected space where both the guests on the panel and in the audience should have or should feel free to say whatever they have to say on this issue. And well, of course, an online conference cannot offer security or safety or this protected space to this extent. So we tried everything to make it safe, sending the login details this morning to limit the group of participants to those who have actually registered. Nevertheless, it may not be possible to discuss everything openly today. There were also panelists who had agreed to participate in March, but now they resigned. They said no, they refused. We do not want to participate talking about the topic of HIV and human rights in this public virtual space. So this reaction shows or illustrates how explosive or how maybe dangerous it still is to work in HIV and or to be committed to this work and to work for civil society organizations in the region we are talking about today. And the big question is today, is HIV work human rights work? In many Western countries this is the case, and it's just a rhetorical question, while in many Eastern European countries it could be considered being a provocation, so it's provocative. The HIV work in the West focuses on individual rights, human rights, and the different realities of people they live in and the well-being of those being affected. And in Eastern Europe, it's a bit, and in the Caucasus and Central Asia region, it's most of the time it's limited to collective healthcare. So prevention still plays a subordinate role, and the cooperation of public health care with civil society organizations, which was one of the success factors in containing the HIV epidemic worldwide, is rejected or refused by many governments in the region, although the non-governmental organizations have much better access to the particularly vulnerable groups or the groups most affected, such as drug users, sex workers, ex-prisoners, and homosexuals. But instead of joining forces with NGOs in the fight, the combat against HIV, NGOs are increasingly stigmatized or considered being enemies and foreign agents in many countries. And the funding of the scope or the room for maneuver are restricted. The unrestrainedly rising number of infections shows that the government strategies are not working and that the exclusion, the marginalization of civil society organizations or this commitment is another driving force of the HIV epidemic. So at the same time, civil society is currently undergoing or is additionally weakened by changes in the financing landscape of measures, actions against HIV. Many countries in Eastern Europe are in a transition process right at the moment, and at an international level, one can say that the finance support, like the help of the Global Fund to fight AIDS, tuberculosis, and malaria, can no longer be provided because of the conditions for the proper use of the money, because these conditions are not in place, or because the countries themselves have enough financial power to some extent. So the countries have to pay for their actions themselves, and this is a huge problem. So care systems that were built up by civil society organizations can no longer be maintained, and people with HIV or tuberculosis and the most severely affected groups are left behind. So what we would like to discuss today, we would like to discuss this topic, speak about it with different panel guests from NGOs, the representatives from Eastern Europe, the Caucasus, and Central Asia. Some of them have been working in this field for a long time, and they are long-time partners of the German AIDS Federation or the Bread for the World, and they have been doing highly committed work, or they work committedly for many years in this area of prevention. And I would like to thank you, ladies and gentlemen, for your work and for being part of this panel. So the disadvantage of this webinar format is that you, as members of the audience, you do not, unfortunately, have the opportunity to participate in the debate actively. But nevertheless, we do have the Q&A function. You can see it in the menu below, I guess. And you can ask questions. And in order to do so, please type in your questions in the Q&A function or this icon. So now I would like to thank our team. Thank you very much for your commitment. Thank you very much for your work. Thank you very much for the organization. And you did it twice, in March and now in December. So I would like to thank Susanne Müller from Bread for the World, Michael Krone from AIDS Action Europe, Alexandra Gorinova from the German AIDS Aid or German AIDS Hilfe, and Peter Wiesner and Teresa Kresse from the Action Against AIDS Alliance. And thank you very much for your support and your work. And I would like to thank our sincere thanks, or I would like to thank the German Ministry of Health for their support. Thank you very much for funding. Thank you very much for your help. And now I would like to hand over to Binod Mahanty. He works at the Federal Ministry of Health, and he in the area of infectious diseases. And now he would like to welcome you, ladies and gentlemen. Thank you very much, Binod. Mahanty, thank you very much for your support. And now I give you the floor. Thank you very much, Sylvia. Also, a very warm welcome from my side. Good morning, ladies and gentlemen. It's a pleasure to be here. And as Sylvia just said, my name is Binod Mahanty. I'm a speaker, or I work for the Federal Ministry of Health in the Department of infectious diseases, on HIV, sexually transmitted diseases, and other diseases. So I'm very happy to be here today, and I would like to welcome you on behalf of the Federal Ministry of Health. So, ladies and gentlemen, now HIV is increasing. It's a pandemic, an epidemic, which is increasing in Central Asia, Eastern Europe, Western Europe. And I think more than 170,000 people got newly infected with HIV, and 99% of these infections took place among the key population. This is why prevention is what we have to do. It's all about prevention, prophylaxis programs. This is important. And also, this will also shape the development and influence the development of the pandemic. So regarding what is also important, can you see me? Is it working? So health care services, services are important, including testing and treatment of the people who need it. And what we can see is that these groups cannot be, or we cannot reach all the groups and UNAIDS and the 90-90-90 objectives for 2020 or 95-95-95 objectives for 2025. We cannot reach these goals. So most of the people do not, so 95% should know that they're infected and 95% should be tested and 95% should be treated. This is difficult, I guess. So all the different reports coming from the WHO and UNAIDS saying or stating that COVID-19 is exacerbating the situation, so it makes it much worse. So the key populations are much more affected due to COVID-19. This is why we think here in Germany, HIV is definitely also human rights work. And it is necessary to create access to healthcare services, of course. And this is independent from sexual orientation or where people come from or social or economic conditions. And this is important. And during the last decades, it proved that this idea is important. So human rights and health rights go hand in hand. So UNAIDS and the Global Fund against, so the GFAM, is also pursuing a human rights related approach. So the different needs are taken into consideration, and the different approaches from WHO and UNAIDS do definitely take care of these needs. So human rights work in Germany, the public health sector, especially when it comes to HIV-related services, works together, joined forces with the civil society and the different communities. So this plays a very important or crucial role for our work in order to be able to address the key populations and to integrate them into our work. But nevertheless, there's much work to do. This is why this approach is a reason, and this is our point of view, that here in Germany in 2019, we had around about 2,000 new infections with HIV among the key populations, and we do have a population of 80 million people here in Germany, and we hope that it will be decreased even more. So regarding our experience when it comes to the collaboration between the public health sector and NGOs, we know that the community organizations and their position and their work need to be supported and enhanced, and we need community-led support. So as the Global Fund will withdraw from the region in the upcoming years, it will be important to organize the inclusion, to include and to integrate the civil society and the organizations in order to reduce HIV infections in the pandemic. I'm very happy, nevertheless, to be here today, even though we cannot meet face to face. But I would like to thank the people who organized this conference, and I hope you will be able to, that you will be satisfied at the end of the day. And again, thank you very much for your work. Thank you very much for the organization. Thank you very much, Binod, Mahanty. Good news, ladies and gentlemen. Susanne Müller will join us in a few minutes. The fire alarm was just a false alarm. So we're very happy to re-welcome her. So now I would like to hand over to Raminta. She is the senior advisor to the UN Secretary General's Special Envoy on HIV/AIDS in Eastern Europe and Central Asia, and she is our host today. and I wish you a lovely day, a great conference, and I'm very happy to hand over to Raminta.
Sylvia, thank you very, very much. So my name is Raminta Stuikyte, and I'm senior advisor to the special envoy of the UN on HIV/AIDS in Eastern Europe and Central Asia, Professor Michel Kazatchkine, and it's really a big honor for me to be helping to moderate this introduction session, which will feature such prominent two keynote speakers, Professor Michel Kazatchkine and Ralf Jürgens. Both of them have been great supporters of Eastern Europe and Central Asia for nearly 20 years, and they helped to develop better, more effective and more humane responses to the HIV epidemics in the region and in very many countries in the region. So I hope that they will help us with their keynote speeches, keynote presentations, to set up the context for the topic of this conference. Is HIV work human rights work? And just before I introduce each of the presentations separately, I will remind that this session is the only session of the today that is recorded and will be made public after the event. And that we will have time for this session until 10:30 Central European time, or that is 11:30 in Eastern Europe. We will hear two presentations, and following those presentations, at the end of the session, we will have short dialogue with our two prominent speakers. If you would like to pose questions, please send them in writing. As Sylvia said, that we have this function of, it's called Q&A, questions and answers, which is next to the function of simultaneous translations. Please pose your questions in, if possible, in English or in Russian language, so that I can follow that and then sort out and pose those questions, raise those questions with Professor Kazatchkine and Ralf Jürgens. And now I would like to introduce Professor Michel Kazatchkine, who is a prominent clinician, researcher, health diplomat, advocate of Eastern Europe. And, you know, we can speak a lot about him. His CV is like 2 pages, just at least a summary of the CV is just 2 pages. He has been the director of the Global Fund to fight AIDS, tuberculosis, and malaria, and supported HIV responses around the world. In most recent years, he is the United Nations Special Envoy on HIV/AIDS in Eastern Europe and Central Asia. And we expect that Michel will help us to understand where Eastern Europe is and HIV in Eastern Europe is right now, what is the status and what is the pathway to ending the AIDS epidemic, and what is the role of civil society and community-driven responses that we heard from Sylvia and Binod Mahanty. Michel, the floor is yours.
Thank you very much, Raminta. Спасибо большое, Raminta. Я буду выражаться на русском языке. Доброе утро, уважаемые коллеги.
Good morning, dear colleagues, dear Raminta. First of all, I'd like to thank Peter Wiesner for this invitation and talking to you, address you today. Throughout the years, as it was already said, I have been privileged to meet many civil society and community organizations in the region. The next few slides will show you some of these memories. Raminta, please, the first slide. So this is the first slide. This is the NGO Envoy from St. Petersburg. They are collecting antiretroviral medication from people who have changed their treatment, or families of people who have died, to send them to patients who are facing disruptions in the supply of medicines. Next slide, please, Raminta.
Can we have the next slide? Это Светанок, Донецкий.
This is Svitanok in Donetsk. They're supporting women who were in substitution programs before the war in Eastern Ukraine. They have a very difficult situation now for their work. Next slide, please.
Здесь представлены решающие встречи.
Here we can see an impression of a decisive meeting between government and civil society advocates in Tbilisi that led to the removal of a legislation requiring that people who are witnessing an overdose in another person first should call the police before then calling the ambulance. Next slide, please.
Здесь знакомые лица многим из вас из России.
Here we see also some faces which probably are familiar to many of you from Russia and Central Asia in the ICAC conference. And now the last slide, please.
И это замечательное меню услуг.
This is a wonderful, let's say, menu of services offered by an NGO at the which is offered at the entrance of the AIDS Center in Ekaterinburg. Dear colleagues, the clock is ticking, and Sustainable Development Goals commit all countries to end HIV and tuberculosis by 2030, sorry, while COVID-19 now threatens us that this progress which we made over the last 10 years might be reversed. The Eastern European and Central Asian region remains one of the two regions of the world where the HIV epidemic continues to grow, in contrast to the continuous decrease in HIV incidence and mortality that can be seen on a global level. Since 2010, new infections in the region have increased by 72%, and AIDS-related deaths have increased 24%. Last year, the incidence of prevalence ratio was of 10.1, higher than in any other regions of the world. UNAIDS reports, as Binod was just remembered, that in 2019, 99% of the new infections in the region occurred among the key populations and their sexual partners. And here I'm defining key populations as those individuals and communities who have a disproportionate burdens of AIDS risk, of HIV risk, and disease, and on the same time lack of access to the essential HIV services. These are people who inject drugs, whose risk of acquiring HIV is 20 times higher than the one of the general population, who presented 48% of the new infections in the region in 2019. Then the sex workers, among the women who have been newly infected with HIV last year in Russia, 2/3 of them were HIV were injecting drug users or cell sex. Then gay and bisexual men who have sex with men increasingly recognize an underestimated epidemic in the region. The next group are the transgender women who have sex with men, prisoners, detainees, and illegal migrants with no access to health services, still vulnerable to deportation from the Russian Federation if found out to be HIV positive. We know that major prevention efforts are needed to reverse the current trends of the HIV pandemic among most affected groups in the region, starting with the provision of community-led services, HIV self-testing, harm reduction programs, and PrEP. The civil society and the community-based organizations are absolutely necessary to fight the epidemic in the region. Key populations and people living with HIV continue to face high levels of stigma and discrimination in the region. As a physician, I'm sorry to say that stigma and discrimination are also often present within healthcare settings, leading to refusal of services, absurd requirements to be drug-free as a precondition of treatment, and of course also breaches of confidentiality. Dear colleagues, let's not forget that sex work is criminalized in Armenia, Georgia, Russia, Tajikistan, Ukraine, and Uzbekistan. Restrictive legislation on propaganda, in quotation mark, targets LGBT communities in Russia and Tajikistan. Same-sex relationships are criminalized in Tajikistan and Uzbekistan. The possession of drugs for personal use is criminal in Belarus, Georgia, Kazakhstan, Uzbekistan. In a number of other countries, thresholds of drugs that, according to law, discriminate between possession for personal use and traffic may be very low, resulting into a de facto criminalization. There are restrictive legislations limiting access to harm reduction services in several countries of the region. And methadone is still illegal in the Russian Federation and in Uzbekistan. The transmission of HIV remains a criminal offense in all countries of this region. And this is why civil society and community advocacy groups are so needed to fight the HIV pandemic in the region. They're needed to fight HIV, but also highly prevalent tuberculosis, multi-drug resistant tuberculosis, hepatitis, and now COVID-19. One can speak of a quartet of pandemics in this region. We cannot address one without also addressing the other three. Or we can even speak of a quintet of epidemics or a syndemic if we consider these diseases together with their underlying social inequalities and determinants. Unless governments and societies address the structural, legislative, cultural, and economic factors underlying these pandemics, the region will never be HIV, TB, hepatitis, or co-free, or secure at least. The civil society movement is largely driven by the fact that governments and politicians do not recognize and do not bring to the public debate the real problems and the issues that people have to face on a daily basis. Therefore, civil society provides an alternative and broader frame for the social debate. Social society is sometimes presented as including non-governmental organizations, advocacy and community-based groups, professional associations, faith-based groups, and academia. However, I do not believe that we should think of civil society as some sort of sociological entity. Daniel Defer, the late founder of the French NGO AID, had said civil society should not be considered as a static group, but sometimes that is something constantly dynamic, something that constantly needs to be built and is subject to constantly dynamic changes. And this is what happened in the struggle against AIDS. We see the civil rights movement the same as we can see it in the civil rights movement from the US. Against fragmentation and corporatism, the AIDS movement has built itself around a broader vision, one that places the person living with HIV at the center of attention, and one that sees public health as an issue of justice and equity. It has done so globally, and also in Eastern Europe and Central Asia, we wish for that. The HIV civil society movement was not built on the model of political activism, of personal commitment to a distant cause. It was grounded on the need of providing immediate practical support to people, affirmation of people's dignity and advocacy for changes that will protect lives. So social justice is the basis for public health. All dimensions of the fight against HIV are about fighting a social injustice. Social minority against majority. Women against a largely masculine power in society. Poor against rich. Democracies against authoritarian regimes. Illicit drugs versus illicit medicines. Every pocket of the pandemic in the region is born out of one or several social inequities, economic, societal, political, or moral. In that context, the aim of advocacy of the HIV civil society is to build a new public opinion that would be conscious and understanding of these injustices. This starts with bringing visibility to the issues. Issues around the pandemic have to enter the public debate. The more an issue is visible, the more there is understanding and the more fears will disappear. This is a very challenging role for civil society in a region where society remains predominantly conservative, where the society has not yet chosen the way in which it wishes to modernize itself. A society that has kept some of its Soviet past, a society where transition times of the 90s have imprinted lasting and profound inequities. A challenging role also in a political, complex and divided region with multiple and diverse aspirations and influences, sometimes looking to the east and sometimes to the west. Civil society in the region has taken two main avenues of work, that of advocacy and that of service provision. Advocacy is about bringing the issues into the public debate. It is about providing the right numbers when reported statistics are biased. It is about speaking of disruptions and services when these are not communicated. It's about bringing the scientific evidence and basis for policies when policies and legislation are based on outdated views and ideology. Speaking about people when a disease is only presented as a set of statistical data. Many NGOs, just as ITPC, have conducted extensive research to base their advocacy on undisputable evidence. Social media bring new opportunities for the mobilization of public opinion, but they also represent an easy-to-reach environment for fake information and conspiracy theories. Service provision, on the other hand, is about bringing the right information to people on means of prevention and therapy. It is about informing people on their rights and providing them with legal support. It is about helping people access the healthcare system. We had the case in Irkutsk, for example, where an HIV-positive woman was not admitted to a hospital, and a community NGO helped them to find an understanding gynecologist. So this is part of the support NGOs can offer, and you could see that on my slides. It's about care and attention, focusing on the human beings and respecting them who they are. This is what NGOs can do. They remain the service providers for key populations in Eastern Europe and Central Asia, with very few exceptions, such as needle exchange implemented through the government aid centers in Uzbekistan. Ukraine may be one of the best examples of how NGOs funded by the Global Fund, PEPFAR, and other sources have contributed in a critical way to progress made in the fight against HIV and tuberculosis at a national level, and succeeded in gaining recognition and trust of authorities. But over the last years, it's more and more difficult to get financing. We're seeing more and more these shrinking society spaces in Eastern Europe and Central Asia. The situation is difficult, and we see these shrinking spaces in all countries of the region. Over the last years, we've also seen that, on one hand, there are very interesting state-run initiatives, for example, based on presidential grants in the Russian Federation supporting NGOs working in the area of HIV, or else a fraction of the income of the National Health Insurance Fund being devoted to a prevention program like in Moldova. But overall, funding from government to NGOs remains very limited across the region. Legal and policy frameworks for civil society may be largely in place, but not adequate to be conducive to civil society. So civil society also faces negative rhetoric by political leaders and media freedom under threat in a number of countries of the region. In the Russian Federation and some other countries, so-called foreign agent laws restrict access of NGOs to funding from international sources, and NGOs under that category face repeated controls and harassment from the authorities. The Russian State Duma, on the government's initiative, is now considering amending the law for non-profit organizations to require NGOs with the status of foreign agent to submit their programs to the Ministry of Justice before they are able to implement their programs. So the ministry would have the right to prohibit the work, in part or as a whole. Civil society organizations from eligible countries to the Global Fund funding many access and funding a number of sub-regional grants that have been awarded by the fund in Central Europe and Central Asia. But as we all know, however, the overall funding for the region has been decreasing in the last years. A number of other international funders have supported NGOs and networks of NGOs in the region, including the Open Society Foundations, the Elton John AIDS Foundation, AFEW, Frontline AIDS, and others. Civil organizations in countries belonging to the Eastern Country Partnership of the EU can access EU financing. According to UNAIDS, Eastern Europe and Central Asia is the region that has witnessed the largest decreases in domestic investment in HIV during the years 2017 to 2019. The COVID-19 pandemic has brought a lot of uncertainty and feeling of insecurity with regard to the midterm and long-term future of civil society organizations in the region, as recently analyzed in the report from AFEW. COVID-19 has indeed also disrupted a number of services delivered by NGOs in the region. But COVID-19 has also come as an opportunity for increased cooperation between government and civil society. There are now a number of examples of such cooperations in the region. Public funding for social purposes, as it is called, for example, can be used by a Russian NGO to implement self-testing for HIV using a Sylvia rapid test. During the lockdown periods, NGOs have redoubled in creativity in many countries to keep people access to some of the services, such as delivery of harm reduction, despite the constraints. Dear colleagues, the fight is far from over. The fight against HIV, tuberculosis, multi-resistant tuberculosis, and hepatitis in Eastern Europe. The fight against stigma and prejudice. And the fight for the dignity of people living with HIV. The fight for equal access to all available means of therapy, but also to prophylaxis to the best standards. It's the fight for establishing health systems that include service delivery by NGOs on a community level. The fight for policies that are evidence-based. The fight to end criminalization of key populations. In a region where close to 50% of new infections are still among people who inject or have injected drugs, criminalization and social marginalization of people who use drugs will not help. We cannot impose health or solve drug-related social problems through a war on vulnerable people. We need, above all, to ensure that human rights are at the forefront of everything we do. Human rights are universal rights. They are also the rights of people who inject drugs, of sex workers, of men having sex with men, of prisoners and migrants. We cannot win the fight against AIDS without winning the fight for these rights. This is why, dear colleagues, we need to continue to strongly support the many remarkable civil society groups in countries of the region who are doing so much, often without adequate resources and in hostile environments. So we have to advance this course. Thank you for your attention. Thank you, Michel, for this keynote speech, which was indeed inspiring to all of us, which offered us a certain reflection about the NGOs, about the communities with whom we're working. And thank you, Michel, for describing also that we're actually facing a quintet of pandemics. And you expressed very well that civil society is a dynamic, continuous project, as we could still observe during the pandemic. Thank you also for describing so clearly how we are working. We shall really respect and accept the people the way they are and not as we wish how they should be. Thank you, and I continue in English.
So I would like to introduce, as I already indicated, another advocate of Eastern Europe and Central Asia and big supporter, Ralf Jürgens, who is Senior Coordinator of Human Rights Work at the Global Fund to Fight AIDS, Tuberculosis and Malaria, and who has been really the designer of much of the thinking of the human rights in HIV field, but also now in TB and malaria, and how private donors and governments could support that work much better, and how to explain that work better and link it with clearly with results, with the impact on the epidemic. So he's one of the wise men in the HIV field, and really privileged to have you speaking about the importance of HIV and human rights work in Eastern Europe and Central Asia, and already some lessons learned and what works. Ralf, the floor is yours, please.
Many thanks, Raminta, and thanks for that nice introduction. Thanks to Peter and everybody else who's been involved in the organization of this virtual conference. Thanks for having invited me. It's a great pleasure and privilege for me to follow Michel Kazatchkine, for whom I also had the pleasure to work. We have something together, Raminta, and who is also a great friend and mentor. Michel already said human rights need to be at the center of everything we do. And I could simply answer the question that this conference poses, namely, is HIV work human rights work, by saying yes. The question is, how do we do that human rights work? And I think that's what I want to talk about, because we are, of course, in a period where human rights, not only in Eastern Europe, but now also in many other countries, much more than 20 years ago when I started my work in Eastern Europe, are not considered to be at the center, are not respected and promoted even by some of politicians of democratic nations. And that poses a particular challenge for us. So you asked me to talk about human rights in Eastern Europe, not only from my perspective as coordinating the work on human rights at the Global Fund, but also because I did quite a bit of work in the region. And yesterday afternoon, as I was thinking about the conference, I thought back to when it started and what I did. And it gives me great pleasure, for example, that Shona Schoning is one of the participants here, and I remembered that she was among the first people that I met in 2005 in Russia when I was working with two big heroes, Anya Sarang and Vitaly Duma, on the proposal to the Global Fund for Harm Reduction Services in Russia, which ultimately was successful and enabled harm reduction services to be provided for a number of years, something that today is no longer possible, unfortunately, through a Global Fund grant in the way that it was done at the time. I worked primarily on HIV in prisons and places of detention. I did that not only in Russia, but very much in Ukraine, in Georgia, in Azerbaijan, in Romania, in Moldova, and I remember those days very vividly. I also worked with groups of people who use drugs in Russia and Ukraine to draft with them the first manifesto that asserted the right of people who use drugs to be involved in all decisions that concern them. The Nothing About Us Without Us manifesto. I evaluated the needle exchange program in prisons in Moldova. I took the director of the Moldovan prison system to Canada to look at opiate substitution therapy in prisons in Canada. And this was one of the few examples where you could see something that you did immediately lead to action, because when the director returned to Moldova, he announced immediately that Moldova would start opiate substitution therapy in prisons. Why am I saying these things? It's because I realized that when I was doing that work, I was hardly ever talking about it as human rights work. It was fundamentally human rights work, and I was a human rights activist. But in order to be effective, I talked about the work that I was doing more in public health terms. I mentioned human rights more or less at the end of the argument. And we all know the reason for that. It was not considered to be necessary to act on human rights obligations and international human rights obligations. People's rights were simply denigrated, they were not respected. And so using simply human rights arguments would not have worked. And I became a pragmatist. I was a human rights advocate and I became a pragmatist. And that's also how the work at the Global Fund is today. And I am going to try and share my presentation now. Let me see. Just give me a moment. I hope this is working now, but I prepared some slides. This is something that Michel has already talked about, why human rights are so relevant in Eastern Europe. He talked about the fact that the epidemic is still growing, contrary to many other parts of the world, that the epidemic is primarily concentrated among peoples whose rights are not respected, gay men and other men who have sex with men, people who inject drugs, etc. So I'm not going to go over this in much detail, but this is some data that we have about the percentage of people who experience various forms of discrimination in many parts of the world. And what you see is that in Eastern Europe and Central Asia, the experience of discrimination is even more frequent than in, for example, Africa or Asia and the Pacific or the Caribbean. We have, in fact, the highest percentage of people living with HIV in the region that experience discrimination, whether it's that they would, people saying that they would not buy vegetables from a shopkeeper living with HIV, whether it's people reporting. You see here at the very top on the right side, you see Tajikistan, Ukraine, Kazakhstan, and Kyrgyzstan among the countries with the highest percentage of people living with HIV who experience discrimination in healthcare settings. And you also see then at the left at the bottom that many people report that they avoid seeking health services because they're afraid of not being treated with dignity, because they're afraid of discrimination. This is great work done by the Eurasian Harm Reduction Association about the consequences of legal and policy barriers, how this affects the lives of people who use drugs in Eastern Europe, the high rates of overdose, the high rates of HIV, the funding crisis for harm reduction. The cost of criminalization is very high, and Michel talked about that already. Now, the Global Fund has as one of its 4 key objectives to promotion and protection of human rights and gender equality. And when I'm asked why that is the case, there's 2 reasons, and I'll go back to this quadrant. We promote and protect human rights and gender equality because that's the only way that we can maximize the impact of our grants. So the executive director, the current executive director, Peter Sands, always said, he's a former banker, so he says, I'm a former banker. For me, it's all about return of investment. We will not be able to get the best return on our investments unless we promote and protect human rights. But how do we do that? And that's what I'm going to talk about, and that's informed by my work in Eastern Europe and Central Asia. It's informed by my experience of having to do human rights work without necessarily calling it human rights work. So the situation when I started at the Global Fund 5 years ago is that very few of our grants were investing in programs to remove human rights related barriers to services. Only 0.7% of investments for HIV and 0.08% of investments for TB were going to concrete programs such as the one that Michel mentioned, legal empowerment programs, access to justice, anti-stigma in healthcare settings, to programs that can reduce people's barriers to health services. So the Global Fund, at the time, the director of the board said, this is not acceptable, this needs to change. We know that unless we tackle those issues, we will never be able to be successful in our fight against HIV and TB. So we made a commitment to scale up programs that can make access to health services for key populations easier. We have an initiative, the Breaking Down Barriers Initiative, and I'll talk a little more about that, that focuses on working intensely with countries to remove human rights related barriers to services. We also have a commitment to invest at least 3% of the allocation of the grant that a country receives from the Global Fund. At least 3% of this amount should be used for programs to reduce human rights related barriers to services. This is not a requirement, but it's an expectation that we have from countries. We also have a so-called key performance indicator, which is about increasing domestic investment in key population prevention programs and in programs to reduce human rights-related barriers. This means that the Global Fund acknowledges that we need to work really hard to ensure that countries not only use funding from the Global Fund for key population prevention programs and for programs to reduce human rights-related barriers, but that they need to start investing in these programs themselves and use the domestic resources to do that. And that's, of course, a big issue in the region, with some countries doing this, with others not doing it at all. This is, I referred to this, we call it the Breaking Down Barriers Initiative. It's an initiative in 20 countries. It means that we work for the entire duration of the Global Fund strategy, which is 6 years, with countries very intensely. We assess at the beginning what the barriers are to services for people. We hold multi-stakeholder meetings in countries to discuss the barriers, but also the potential solutions. We then work with countries to help them develop country-owned, costed, multi-year plans to reduce human rights-related barriers to services. And we evaluate this effort very deeply, because we know that we need to invest in programs to reduce human rights-related barriers for people to have greater access to services. But there are still skeptics, and so in order to convince those skeptics, we need to document the results and the impact of that work really well. Now, this is what I call the pragmatic and programmatic approach. We call these programs the 7 key programs to reduce stigma and discrimination and increase access to justice. Now, we could have called them the 7 key human rights programs, but we are not calling them the 7 key human rights programs for a reason, because that would be a barrier for some countries to engage with us on those programs, to include them in their funding applications. Simply using the word human rights programs would be a barrier. By calling them 7 key programs to decrease stigma and discrimination, to fight stigma and discrimination and increase access to justice, we pragmatically acknowledge that human rights are not favored by many countries, and that many politicians these days actually oppose human rights, see them as a concept that is imposed on them. Of course, this is not easy for me as a human rights advocate, but this pragmatism has helped us get countries to fund these programs, not only with funding from within their from funding that the Global Fund has given to them as an incentive for these programs, but also from within their allocation. So it's a pragmatic and a programmatic approach to human rights. Programmatic approach meaning that we fund these programs, we create incentives, we expect countries to fund these programs with Global Fund grants. This is the list of 20 countries in which we provide this very intense support over 6 years. And as you see, 2 countries in the region are part of this effort, Ukraine and Kyrgyzstan. I'm going to talk a little bit more about this later on. Now, what we have seen is that our pragmatic and programmatic approach seems to work. And go back to this slide, because you will also see on this slide other countries that are not known for their record of protecting and promoting human rights, such as, for example, the Philippines, where you know the president has declared a war against drug users, where people who use drugs have been shot. And Uganda which is another country that is not known for protecting and promoting human rights, and where in fact men who have sex with men are routinely rounded up by police, arrested without any reason, where homosexuality is a crime, etc. We included these countries in this cohort because we wanted to see whether we can do human rights work even in the most difficult settings, and how we wanted to learn how we needed to do that work in order for it to be done effectively. And for example, in the Philippines, when I went to the Philippines, I went to the multi-stakeholder meeting where stakeholders from all over the Philippines came together, including the Ministry of Justice, the Ministry of Health, people who use drugs, community. We did not, at the first meeting, use the word human rights. We talked about this work without ever mentioning the word human rights, and we were able to get the government to do all the things that we wanted them to do, with the exception of the one thing that we knew from the very beginning we would not be able to do, which was to change their approach to drug laws and policies. We were pragmatic. We wanted to do work in Philippines to advance the right of men who have sex with men and sex workers to services. We wanted to do everything that we could for people who use drugs. So in the Global Fund grant, there's legal empowerment programs for people who use drugs. There are shelters for people who use drugs where they can safely access treatment and testing. We knew we would not be able to get needle exchange programs to them, but very pragmatically, we went about this work, and we didn't call it human rights work. We called it work to reduce stigma and discrimination and provide access to services. Now, in the 20 countries in this cohort, the funding going to these programs to reduce stigma and discrimination and increase access to justice increased sevenfold in the last 3-year allocation period of the Global Fund. Previously, in a 3-year period, only about $10 million were invested for these programs. In the next 3-year period, nearly $80 million were invested in these programs. In the current allocation, because the current Global Fund has started a new allocation this year, meaning countries are accessing new funding from the Global Fund, we are seeing a further increase. And what is most notable is that that increase comes from funding that countries could use for other things. Some of this funding, because part of this initiative is that we provided an incentive to countries. We offered them some funding that they could only access if they used it for programs to reduce human rights related barriers, but only if they also used some funding that they could have used for other investments. Only then were they able to access the additional funds. Now countries are using more and more of the funds that they could have used for other things, for treatment, for prevention services, etc. They're using it for programs to reduce human rights related barriers because they're starting to understand that they're important and that they're necessary for them to achieve their goals. 13 of the 20 countries, including Ukraine and Kyrgyzstan, have adopted multi-year plans to reduce human rights related barriers to HIV and TB services. They now have their own country-owned plans. This is no longer seen as a Global Fund plan. It's the Ukraine's plan to reduce human rights related barriers to HIV and TB. It's Kyrgyzstan's plan. Now, what we are currently undertaking midterm assessments to see what results and impact we see in countries. Ukraine is one of the first countries in which a midterm assessment was undertaken, and I will get to that in a moment. I want to highlight, and I hope that everyone can access this set of slides, I want to highlight the implementation guide that we developed together with Frontline AIDS, and that was funded by GIZ. It's a recognition that the programs that I'm talking about, whether they are discrimination in healthcare setting, whether they're a program for police, it's whether they are programs with the judiciary, whether they're legal empowerment programs or access to justice programs, that they can be implemented in many different ways. But we now know that certain ways of implementing them are much more effective, have much better results. We now know, for example, that it makes sense to integrate these services to the extent that it is possible with treatment and prevention services rather than create a separate silo of human rights programs. Integrating them in other programs makes sense. And I refer to this guide particularly also because it's available, in addition to English, it's available in Russian. So people can access that guide on the at the address that I give in this slide. Now, this is a busy slide, but this summarizes the results of work in Ukraine. And you all know Ukraine is maybe not representative for the countries and the regions. A lot more often tends to happen in Ukraine. There's an incredibly vibrant civil society with very strong organizations that have been active for many years. But what you see here is, at a glance, that we have a system to assess progress made in countries where a baseline was established based on the assessment that we did at the beginning of this project, where we assessed where countries were in terms of implementing sufficient programs to reduce stigma and discrimination and increase access to justice. And we did that for both HIV and TB. And you see in the middle that the baseline for Ukraine for HIV was 2.8 and for TB it was 1.2. Now, after 2 years, Ukraine had advanced, and advancing meant providing more services to more populations in need of those programs in more locations where they were needed, with adequate funding and taking into account, for example, gender responsiveness, etc. So clearly we documented progress, and we have similar progress, although not as much. In Kyrgyzstan, this Ukraine assessment is already available on the Global Fund website. You can read about, in much greater detail, about what was achieved in Ukraine over 2 years. The Kyrgyzstan assessment will be available on our website in January. Now, this is to say that a very pragmatic and programmatic approach seems to be providing good results, increased access to services for people in need, also in some of the most difficult environments, and that tailoring the approach to the country where the work is done, using human rights arguments where those arguments have traction, refraining from talking about this work in human rights terms, but doing exactly the same work seems to be working. And I think that's very important. Another element of this work is when you looked at the list of programs, I'm going back to the list of programs here, you see that, of course, one of the 7 key programs to reduce stigma and discrimination and increase access to justice is monitoring and reforming policies, regulations, and laws. Ultimately, we need to change laws that criminalize sex work, drug use, etc. But we also know from our experience that this takes time, that it may not happen in many countries in the region over the next 5 years or so. But we can do work to increase people's access to health services, to ensure that they are treated with dignity when they seek HIV or TB services, that they're not denied these services, that they're not mistreated by law enforcement officers. We can offer them legal empowerment programs where they learn what their rights are and assert their rights. We can offer them access to justice so that when their rights are violated, they have access to justice. We can do those things in the absence of what we ultimately have to do, which is changing laws. It's also important to acknowledge that we know from experience that even when you change the laws, ultimately, even when laws are changed, that alone will not enough. You still have to implement all those programs because the change in attitudes, the discrimination, the lack of dignity that people experiences doesn't change automatically when a law is changed. It takes time, so you still need to do work to reduce stigma and discrimination in healthcare settings, to work with law enforcement officers, etc. Now, finally, Michel also talked about COVID already. COVID has exacerbated human rights issues in many settings. We have seen increased violations of human rights of key populations in many settings. We have seen disruptions of services. Eastern Europe has done better than most other regions here. We have seen less disruption. We have seen communities reacting very fast and very well. But still, that remains a risk, and we all know that next year will be a very difficult year still, with potential disruption of services, more lockdowns. And the Global Fund has reasserted the centrality of human rights. It has provided a guidance note that you will find on the Global Fund website on human rights in the times of COVID, asserting that we need to take a rights-based and gender-responsive approach. It reaffirms the commitment to human rights and gender equality, and it gives some concrete guidance on how programs can be adapted to the realities that we have been facing under COVID. And again, here, as in our other work, we sometimes refer to this explicitly as human rights work. We don't refrain from that. Our executive director doesn't only say that we need to do this because it increases the impact of our grants. He also says it's the right thing to do. It's required by human rights. But I want to finish there and look forward to any questions that you may have. Thank you very much.
Thank you very much, Ralf. Thank you very much, Michel. And I think, Ralf, thank you for sharing also your own journey, how sort of you advocated for human rights without calling them sometimes human rights, but without calling it human rights work, and that sometimes that's the pragmatic approach to take in order to resonate with authorities, etc. We have 2 questions, and one question is already answered in terms of COVID and impacts in the region in particular. But one question that came from, and thank you, Yulia Antarashenko, for posing it, it's very much resonates also what Michel was saying, that we need to change the attitudes of the society in addition to legislation and etc. So the question to you both, but Julia particularly wanted also to hear from you, Ralf, in addition to Michel, how to change those attitudes. Have you seen that it worked somewhere in pragmatic ways or not? Like, what are the lessons learned? What actually changes? How to change that so that we see something very specific in the society, not only in the books, but also in practice. And I see also one more question, I apologize, but I will pose it as well, that there is no doubt human rights, gender inequality related barriers are the major bottlenecks in addressing HIV, TB epidemics in the region. Any ideas what would be needed apart from strong advocacy, political will from decision makers, which is currently often lacking? So sort of how to address those. And then third question, just for your comments, is like how to support the region. Like, what would you prioritize to support the region in the context of closing civil society spaces? So how to make also sure that the support is helpful and not harming the groups? Michel, maybe you first.
Thank you. I think on the first question, we've gone through that phase in the first 20 years of the epidemic in Western countries, and we're still somewhere in the almost at the end, but still not far from the first 20 years of the epidemic in Eastern Europe that started later. I think the answer is make issues visible. Don't speak of HIV but speak of people. Tell stories, have the people visible. As I was trying to say in my presentation, the more things are visible, the more they're discussed, and the less the fears continue. So it's providing a human image. And I think this is something that is also missing very much around the COVID-19 debate, which is very much about numbers and very little about people. Sorry, I've forgotten the second question, Raminta.
So the second question is, what would be needed apart from strong advocacy,
yes,
for political will? And
yes,
just I will add also one from Ula Pape. There is also a question like, who could be the allies?
Well, I was going to say there isn't a society and then the decision makers. I mean, there are, even in some of the authoritarian or more authoritarian countries in the region, there are parliaments. I believe that this is an intermediary that we haven't been working enough across the region. And my experience in several countries in the region is that a health commission, a justice commission, a social commission of parliament can actually move something. And we should also keep in mind that many people from these commissions, one day or another, turn out to be in power. So sometimes it's very difficult to talk to a so-called decision maker, a minister, a deputy prime minister. It depends very much on the individual. But talking to a group of parliamentarians, and let me just cite an experience I had 2 weeks ago. 2 weeks ago, I addressed the commission, the social commission of the Interparliamentary Assembly of the CIS in Minsk, with Davron Mukhadamayev from the International Federation of Red Cross and Red Crescent. And we presented to that commission a model law for equal access to HIV prevention and treatment for all in the region. And the comments were very positive, and that model law will then be discussed and hopefully approved by the plenary assembly in 2021. As all model laws, it is shy. It may be shy, but I'm looking at Ralf, and I'm saying this is also a pragmatic attitude, because even if we make a little step, pragmatic little step in having all countries accept a frame, a model law, then at country level, we can use that as a tool to move towards reform. So my straightforward answer to that question somehow would be more work with parliamentarians. And I'll stop there.
Thank you. So Ralf, your thoughts about society attitudes, who could be the allies to change views, but also for human rights work? You probably see the ULA question, and maybe let's add also the question from Anke van Dam, who is asking about local authorities that haven't been fully acknowledging the important and complementary role of civil society, and if the Global Fund is discussing an indicator for the level of collaboration between local authorities and CSOs, and maybe some tips also about how German partners could support the region and human rights work.
Thank you very much. Difficult questions. And first, the attitudes of society. I think what struck me most, I mean, I've been doing work on HIV primarily in human rights since the mid-80s, when I was a student at University of Munich, and the government of Bavaria started introducing very restrictive policies and laws, and that's how I started being an advocate. But what struck me is that everyone seemed to acknowledge and say human rights have to be at the center of the response, but that there was no funding going, or very little funding going, to the programs that I talked about. We talked about stigma and discrimination, and there was hardly any funding going to programs to reduce stigma and discrimination, whether that's in specific settings, such as healthcare setting, or in society overall. We sort of assumed that this would change simply because treatment is available, but that's not true. We have to invest in real programs to change attitudes of society. And there are examples of good multimedia campaigns, multi-year campaigns. This is not something that happens just in 3 months. You have to have a plan, and that's why we have been working with countries so that they adopt multi-year plans to address these issues, including societal attitudes. And we have learned more and more about what works and what doesn't work in various settings, and we can apply those things, and we need to fund them, and we need to apply them over many years, and they need to include what Michel said, working with the communities, giving people the voice, but they need to include other things. So that's about attitudes of society, and really we simply didn't take that seriously. We talked about it, we said it's a big issue, but then we did do very little about it. It's starting to change, but still a lot more needs to be done. Who could be allies? My approach to this has always been, you don't really know before, but you have to try. And when we organize these so-called multi-stakeholder meetings in countries, what I always insisted is invite people that we don't usually invite to such meetings. See whether we can find other people who will support these efforts. And we invited the police, and we invited the churches, and we invited healthcare workers, and we invited, of course, centrally communities of people living with and affected. And ultimately, when you brought all of these people together, something happened that was quite compelling. Namely, people started listening to each other and started becoming allies, or at least friendlier towards the views of others, if not allies. So I think we need to try that to a greater extent than we have done so. Working with local authorities, and Anke, it's great to see that you're there. Looking with local authorities, of course, we have realized that in many places you can achieve a lot more actually with local authorities than with national authorities, that there's just a complete lack of movement at the national level, while local authorities realize what the problem is and that it doesn't go away without pragmatic action, and they want to do things that national authorities don't allow them to do so. So we have to work a lot more with local authorities and to see what can actually be done locally that may not be possible nationally. And how to support the region. As Michel said, unfortunately, many funders have left the region, but others are still thankfully engaged. The Global Fund is thankfully still funding in most countries. We are working hard on sustainability of programming. We provide incentives, such as the ones that I talked about. We need to do more, and I really look forward to suggestions and engagement on that. Thanks.
Thank you, Ralf. Any last words, Michel?
Yeah, I was just, I wanted to ask Ralf actually, whether in relation to the last question you were answering and we received, and thank you to all who asked questions, don't you think the funding NGOs in a national government program could be one of the activities that you would encourage and monitor in your program? Wouldn't that be one of the good starting, easy to monitor activities that would indirectly, but certainly directly serve the cause?
Yeah, and that's a discussion, Michel, that is happening as we are looking at incentivizing domestic investment in the programs that we have learned from our experience. Governments are least likely to want to fund key population prevention programs and human rights programs. Of course, there first needs to be the legislative basis for being able to do that, so social contracting, but there also needs to be the willingness to do so. So we have decided to work very deeply and to make that a priority for work in 21 countries, including quite a few countries in Eastern Europe, and to see, when we work on this issue much more deeply over a long period of time and having a key performance indicator attached to that, what we can achieve. So we are currently working on setting targets for each country, how much of their domestic investment should go to key population prevention programming and how much should go to programs to reduce human rights related barriers. And we know, of course, that in many countries currently 0% of domestic investments is going to these programs. So setting a key performance indicator, setting targets for each country, and then working on this as a priority for the next while, I think is the right step. Of course, it's a formidable challenge. Some people say I'm completely crazy that we have such a key performance indicator. The former executive director at the Global Fund, when that key performance indicator was set, he said, Ralf, I'm so glad this is exactly what the Global Fund should be doing, but I'm so glad that I won't be there and that you will be the one who will be held accountable for it.
Ralf, I'm asking the question, and maybe Raminta, I know it's time to conclude. You could say a few words, because Raminta has been doing some work recently that shows that COVID-19, in fact, in the region, and you and I alluded to that, answering Peter Wissner's question, has been also an opportunity for more for closer linkage between government and NGOs in a number of countries in the region. So maybe we're at a time of opportunity for addressing this issue of funding NGOs on domestic budget.
Yeah. So with that, let's try to wrap it up for this morning, because there will be other sessions where these potential areas for also, suggestions for the Global Fund strategy, and the Global Fund is now shaping its strategy for post-2022. Something that maybe could go back to the Global Fund. In 1 hour, there will be a panel discussing transition. And I think that conversation about the local authorities, like what is their role, or like civil society funding and government funding of civil society, not only for delivering of services, but also human rights work and advocacy, how that could reflect in the Global Fund strategy in the future. And, further discussions also, how Germany maybe also could support those ideas in the discussions of the Global Fund strategy, but also, through very important work that Germany, both government and civil society is doing to support Eastern Europe and Central Asia. So with that, it's not the end of the discussion, but I wanted to thank very, very much our fantastic panelists. And thanks to all participants who posed questions, but also who stayed with us slightly longer. And I know that for a conference that is organized by German NGOs, it is hard to be so late, 15 minutes late to close this session. So I apologize to organizers for that. But I think that was good time to take the questions and to hear wisdom of our two speakers.